Hello, hello, hello. It is Jenn and Andrea, and we are back.
We're back.
Today is an amazing episode that I think all of our listeners are absolutely going to love listening to. We are going to be talking about what I truly believe that every single woman in our age is either Googling at 11:30 at night, 3 a.m. in the morning when we cannot sleep, and looking for answers. Today, we're going to be talking about GLP-1s. We're going to be talking about peptides, belly fat, collagen loss, all the stuff us midlife women are struggling with.
Yes, today we are getting the answers we have all been waiting for. And our guest today is the owner of DrippyNurseJess Med Boutique in Gilroy. Jess, we're so excited to have you on today.
Jess, thank you.
Thank you for having me. I'm super excited to be here.
Oh, thank you.
We know that you're a busy woman, so this is very big to us.
Yes, appreciate it. So please tell us a little bit about yourself.
So I'm Jessica Harper. I am the founder of DrippyNurseJess Med Boutique in Gilroy, also known as DNJ Med Boutique for short. I've been an RN for 13 years, specifically in the surgical space. I was the plastic service lead for about 5 or 6 years at Kaiser. So I'm very versed in plastic surgery. I'm a mom. I have 3 children with my husband of 21 years, 2 of them in college, 1 on his way. I'm also in college. I'm pursuing my master's in nursing. So this time next year, this time in 2 years, I'll be a nurse practitioner.
Awesome.
So a lot of exciting things to come.
Yeah, that was awesome.
Yeah.
So how did you get into aesthetics and wellness?
Well, it all started with the pandemic burnout. I was working the hospital life and, 2 years into the pandemic, 2022, I think it was, I was like, there's got to be a better way. So I was scrolling on TikTok. I saw these nurses doing mobile IV therapy. I'm like, what are they doing? How can I do it? So I applied for a job with a local company that does it, and they hired me on the spot. I learned the ins and outs quickly. And my husband was like, you need to start your own business doing this in the South Bay area. Because I was like all over San Francisco, Palo Alto.
So that you were traveling.
I was traveling, visiting these homes in like the hills. And I wanted to bring it to Gilroy, Morgan Hill, Hollister area.
Right.
So that's how D&J was born.
Yes.
And then I slowly started training in aesthetics. I've always been interested in aesthetics, being that I was a plastic surgery service lead in the hospital. So I started training in aesthetics. I took this like BS weekend course that you have to take to get certified. And then from there, I found a mentor. I did hands-on training. I attended all the conferences. So I became well-versed in aesthetics. And that's when D&J Med Boutique was born.
Yeah. So tell us about that, because I'm really excited about it and I've been there and I love it.
Yeah.
So tell us about the spa and...
Yeah. So we're located in Gilroy. We have 2 treatment rooms. We offer aesthetic treatments like your tox and filler. We also offer microneedling, chemical peels, regenerative medicine like Radius and Sculptra. We also offer IV therapy and wellness shots. GLP-1s for weight loss, and now we're introducing peptides.
Awesome.
Wow.
I love
everything.
all the good stuff.
I know,
right? All the
Everything we
delicious
need.
stuff.
Yeah.
Everything we need.
It is so true. And it's so big right now.
Right. So what is regenerative medicine? Like, what does that mean?
So regenerative means supporting the body to repair and rebuild, reduce inflammation, support the body in weight loss, stimulate collagen and elastin. So those are the main things that regenerative medicine includes.
Oh, that's great.
Awesome.
Yeah.
Yes.
Do you believe that these days women are masking aging, or do you think that they are improving aging?
We're definitely improving function if it's done correctly. If it's done correctly, we are decreasing inflammation. You've heard of the word inflammaging, right? Inflammation causes a lot of aging. So if we can reduce that, that's a big win within itself.
Yeah.
Right.
Right.
We're increasing collagen and elastin stimulation to give you better skin structure, and we're supporting the body to build muscle and lose weight with peptides and GLP-1s.
Yeah.
So we're definitely not masking anything.
Oh, okay, good.
Yeah.
Good.
Nice.
Good. Good. So speaking of GLP-1s, this is huge right now. And I feel like everyone's on GLP-1s. And I want to know a little bit more about it.
Yeah, definitely. GLP-1s are actually a peptide that mimic a hormone that we already have in our body, and they help suppress appetite, slow gastric emptying, decrease inflammation. So everybody loves them. Everybody wants to be on them, like you said.
Yeah, everyone is.
Yeah. Of course, there's a right way to do it and there's a wrong way to do it. And, when you see us at D&J, we kind of like guide you through that. We don't just give you the medication and say, okay, good luck.
Yeah. Right. So who's a good candidate for it?
Good candidates would be adults who suffer from obesity, insulin resistance, metabolic syndrome, like high blood pressure, diabetes. Anybody that has, over 15 or more pounds to lose definitely benefits from it. We're starting to see people now go on like microdose.
Yes.
So we're starting to accept people now that want to microdose, kind of keep their inflammation at bay. They may have a few pounds to lose. So we've seen an increase in that kind of patient.
We've been seeing, I hear a lot about how midlife women who do put on an extra like 8 pounds or something like that, that they are microdosing, and it's helping them keep that, those pounds off that just really get to them.
Yeah. Midlife.
That midlife, just
Yeah.
like, I know people don't believe that, but when people do, start getting into their 50s and stuff, that does happen.
Yeah, absolutely. What I see a lot is people in their midlife with a lot of visceral fat.
Yeah.
So like fat surrounding their organs. And, that's correlated with insulin resistance and metabolic syndrome, diabetes, hypertension, and a lot of inflammation. So if we can get you on a GLP-1, we can decrease that visceral fat, which is a key indicator in longevity of life.
Yes. Yes, totally.
So are there benefits beyond weight loss being on?
Oh, yeah, absolutely. I've already mentioned some of them. Decreased inflammation. Like you feel bloated, your hands are swollen, your feet are swollen. You'll see a difference when you're on that GLP-1. There are clinical studies showing cardiovascular benefits to it as well. The FDA hasn't approved GLP-1s for that yet, but it's literally such a gray area right now that there's going to be so much more to come.
I know.
In regards to GLP-1s and peptides. So I'm super excited about the future of that.
Yeah. So what do you think about, I've heard a lot about women who are on them, but really, really do struggle, even after taking GLP-1s, that they've got it seems like they've got more belly fat, or they feel like they're carrying a lot of fat still in their belly. Is that a thing, or is that a myth? Or do you think that's just...
Well, I think it has to do with patients who are on GLP-1s who aren't doing what they're supposed to be doing. A lot of people take them thinking it's a magic pill.
Yeah.
And it's not. You still have to eat healthy. You have to prioritize your protein. Have to lift weights. If you don't lift weights and you're just losing weight on the scale, you're losing muscle, not fat.
Yeah.
Right. So you have to be compliant. All right. People come into our office. I tell them, okay, prioritize your protein, lift your weights, drink your water, walk, don't do too much cardio.
Yeah.
And they don't do all the things. And next thing you know, we get them on the shape scale and they've lost a ton of lean mass.
Yeah,
right?
that's what we hear.
I think that's the big thing I hear from people, that they lose the lean muscle.
Yeah. And that's something you can control. What you can't control on GLP-1s is loss of fat pads in your face, loss of collagen, loss of elastin, and we've all heard of Ozempic face.
Yes.
Right?
Yes.
So that's where biostimulators like Radius and Sculptra come into play.
Yeah.
And what we like to do is get ahead of the game. We'll start you on a treatment, when you start your GLP-1s. So that, because it takes 3 months to stimulate collagen and elastin, it's not an immediate, thing.
Yeah.
So we like to get ahead of the game and start that. That way, when you've lost your 40 pounds, you don't look sick in the face, right?
Yes, because there's so many people are like, oh my God, I have Ozempic face, or they get bags, or, then they start feeling old because they've lost this weight. And like you said, it targets the face in a lot of people.
Absolutely.
Right?
Absolutely. And it's not just about needing biostimulators. You also need to replace some of that volume that you've lost.
Yeah.
But when done tastefully and not overly filled, it looks really good and natural.
I bet.
Oh, yeah.
So how long should someone be on it?
On GLP-1s?
Yes.
Depends on their goal. If they have, 20 pounds to lose and they lost their 20 pounds, usually I see about a 20-pound loss in like 3 to 4 months.
Wow.
Yeah. If they want to stay on it long term, they can. That's when we microdose and we keep them on a low dose, the lowest dose, so they can stay on it forever.
Right.
But of course, that takes a budget, and not a lot of people have that.
Yeah. I mean, it is expensive to do GLP-1 monthly, right? Like it's an expense, but it's worth it.
It's an investment.
Yeah. Yeah. It's an
investment in your health.
Yeah.
We have recently decreased our prices on GLP-1s because we do want to make it more affordable for the community. So we recently did that.
Good.
We've gotten very good feedback on that.
Oh, good.
Yeah.
Great.
Okay, so I've been wanting to ask you this because I went into your med spa, which I love to go, and I went and got my Latisse. And I kind of peeked into one of your rooms, and you had this, like, I went in, it was a scale, looks like a scale, and it had all these like lights on it and stuff. And so I think I had asked you, like, what is that? So you told me it's a shape scale. So I've never seen that in another med spa. So can you kind of tell us like what that is and how it works?
Absolutely. The shape scale is a 3D scan of your body. It gives you a comprehensive analysis of all your numbers. So your weight, all your measurements, your lean muscle mass, your body fat, how much visceral fat you have.
Okay.
So it gives you all those numbers. So what we like to do is we get a scan of our patient when we start them on GLP-1s, and then we have them come in monthly and get back on the scan and see how much they've progressed. And that's usually when I know they haven't been compliant.
Because you can tell by their body mass, their muscle mass, right? Okay.
Right. So that's our shape scale. We have it in office for everyone, but it's completely free for our GLP-1 patients.
Awesome. Right. And that is a huge benefit.
Yeah, definitely. You can get GLP-1s anywhere now online on the black market. Most of them are from labs, which you don't want to get.
No.
But when you're getting them through D&J, you also get to see a provider. You get to talk to them about, what you're doing wrong, what you're doing right. You get to see your shape scale numbers. So it's not just injecting yourself and go.
Right. So you're making sure you're doing it the right way.
Absolutely.
Yeah.
Right.
No, I love that.
Absolutely.
So how often should women track?
Their shape scale? We have to do it monthly.
Okay.
Yeah. We're doing it monthly. We have them come in. We make sure they're wearing tight fitted clothes. If not, you're stripping down to your underwear. But we like to see them monthly so that we see that 4-week progression.
Right.
Okay. I want to talk about peptides. I want to know what they are and what they do.
Good question. A lot of people want to know what they are and what they do.
Yes, they do.
Peptides are very new. They're a gray area. We're still learning about them. But basically, the definition of peptides is they are a short chain amino acid that tells your body what to do. So you have peptides that will tell your body to build muscle. You'll have peptides that'll tell your body to burn fat, build collagen, tighten skin. There's peptides out there that will supposedly, they tell your body to whiten your skin. There's peptides out there for mental clarity, brain fog. So there's a lot out there. And we are just starting to dabble into peptides.
Okay.
So we're super excited about what's to come with that.
Oh, cool.
Yeah.
That's exciting.
Yes, very exciting.
Yeah.
So glutathione, that is a big thing. All my friends are, talking about it. I have been taking it in a liquid form. And I definitely see it definitely cleanses out my body, like it's a, detox. But can you tell us a little bit more about it?
Yeah, so glutathione is a powerful antioxidant. Some call it the mother of antioxidants. It detoxes the liver. It gets rid of free radicals and oxidative stress in the body. It decreases inflammation. It boosts the immune system. It gives your skin a glow. I have seen some amazing transformations of patients that come in and get like a weekly glutathione shot.
Yes, we need to do that.
Yeah.
I've done it at your place and it's amazing.
Yeah.
I need to do it more often.
It's amazing. I mean, I had a patient that she comes in and she has lupus. And the first time she came in, she was so crippled by lupus. She could barely walk, barely breathe. And 4 weeks later, after I saw her, she was coming in weekly for glutathione shots. So at the 4-week mark, she did a complete 180.
Wow.
She was like booking her first trip. She hadn't gone out in years.
Oh.
She was able to go grocery shopping with her husband. I was blown away.
That's crazy.
Glutathione always blows me away in what it could do.
Yeah.
So I absolutely recommend Gluta.
So do you offer it? I want to know this personally because I did the shot with you, and I know that some people come in and do the IV drip of it. Is there a difference of that, or?
Well, the only difference is when you come in for an IV and we give you Gluta through there, the IV, you also get hydration, right?
Okay.
You can also get B12, B complex, vitamin C, zinc, all in one IV versus a bunch of shots, right? So it's up to you if you want to get the shot or the IV. Obviously, if you need hydration, I recommend an IV, but either one is great.
Oh, okay. Awesome. That's really good to know. Yeah, I didn't know that.
Yeah.
And I was wondering the difference because I wasn't sure if I should have gotten the IV or, the shot.
Yeah, maybe after a long weekend of partying, you can get the IV.
Yeah. For sure.
Definitely. Yes. Detox us.
So you do not think that glutathione's hype. It's just science. It's science. There's a science behind this and it's legit.
Absolute science behind it. There's clinical studies on it. There's scholar reports on it. Definitely science. If not, I wouldn't have repeat clients coming in.
Okay, awesome.
Yeah.
So we'll be your repeat clients from now on.
Yes. Okay, Jess. So we keep hearing about the Swift lift. What is that?
Yeah, so the Swift lift is actually a technique that I've learned from Dr. Arthur Swift. He's based out of Canada. He's been in the game, the aesthetics game. He's a plastic surgeon, been in the game for like 30 years or more. And he was tired of overfilling faces.
Yes.
So
everyone's tired of overfilling faces.
Yeah.
Yes.
So his technique basically uses minimal filler to kind of lift things and soften things. So that's a Swift lift. It's not one size fits all. The Swift lift is not the same technique for everyone.
Oh, okay.
It just depends on your needs. So one of us nurses will assess your face, see what you need, and then we will proceed from there. So, whatever your friend got for the Swift lift, you're not going to get the same thing.
Okay.
Everyone's different.
Yeah. Well, some people get Botox in their neck, right? Because they start getting this neck and what are the lines?
Absolutely. The platysmal bands.
I have,
They're very prominent.
Yeah.
Right. And as we get older, I guess we just lose collagen, elasticity, and we get those bands, correct?
So we always have those bands. They're actually muscles that help us hold up our head. So we need them. We need them.
So if we're paralyzed,
then
we're paralyzed.
So Botox paralyzes them slightly. We don't want to overdo it because we want you to be able to hold up your head. Wow. So that's where training comes into play, right? We don't want to start injecting your whole neck.
You get the wrong injector and you're like,
Can't even swallow. Yeah.
oh God, that was my worst fear.
Wow.
But no, Botox is great for the neck.
Okay. So you can still do that with the Swift lift or.
Absolutely.
Oh, okay.
I'm really happy now to see, especially even the celebrities out there, not looking so puffy. Because those fillers, it just was not a good look.
I'll tell you what it is. So what you see with these celebrities who look super puffy and then all of a sudden they do something and they look great.
Right.
So they started with a bunch of dermal filler. Dermal filler is hyaluronic acid. It attracts water. So if you have way too much, you're going to look puffy.
Oh.
Right? When you're sick, have a cold, when you drank too much, if you ate too much salty foods, all those things are going to cause you to look puffy. And when I say when you have too much filler, that's like 30, 40 syringes.
Yeah.
You know, a little bit of filler is it happens over the years. It happens. A little bit of filler is good. Everyone needs a little bit of filler. There's no need to be scared of it.
Okay.
Too much filler is bad. So what have these celebrities done? They've dissolved all their filler and they've gotten biostimulators, Radius, Sculptra. They've gotten blepharoplasties. They've gotten deep plane facelifts. So they've kind of, changed the trend, right? And so we're seeing a lot of that now.
Right.
I have, again, my average patient is 40 and up, woman. She's like, I'm noticing the jowls. I'm noticing these are deeper, my necks. And I'm like, I have the right thing for you. We're using Radius, not a bunch of HA filler. And the results have been amazing.
So tell us about Radius, because I've heard you talk about it several times watching you on Instagram. And so I have never used Radius and I would love to hear about it. I'm sure everybody else would.
Yeah. So we'll have to change that. We'll have to get you in for a treatment.
I know. It's true. Yeah.
So Radius is not a hyaluronic acid filler. It is calcium hydroxylapatite. That is a big word.
Yes.
We call it CAHA for short. Basically, it stimulates collagen and elastin. So it's calcium-based. It mimics bone. And we can use it in two different ways. One, we can use it for volume. It's beautiful on the cheeks, in the jawline, in the chin. And we can hyperdilute it and use it strictly as a biostimulator.
Oh.
So it's great for the temple area, the preauricular space to tighten, thicken, and pull back the skin.
Okay.
We can use it in the pre-jowl sulcus here. A lot of women lose volume here and in their chin shadows. We can use it in the hands, the back of the hands, the neck, the décolleté, the booty.
Wow.
We can use it in the tummy. If you have a little bit of loose skin from having babies, we can tighten that up. If you have loose skin above your knees, we can use it there. Crepey skin in the arms. It's amazing.
So it's like better than like Voluma, or is it just different? It's different.
Voluma is a hyaluronic acid filler.
Okay.
So Voluma will plump you up and make you look puffy if you have too much of it.
Yeah.
It's completely different. Voluma does not stimulate collagen and elastin.
Okay.
Radius does.
Oh, so this is, I think, right, a better way to go than people going to have plastic surgery done, right? Going under the knife?
Well, it is an option, right? If you are someone who you're 40 or you're 50 and you're not ready for a facelift, which I don't think you should be at that age.
Right.
I think it's a little too young. You got to remember facelifts only last 10 years or so. And even when you do get a facelift, you still need Radius.
Okay.
Right? The facelift pulls back, right?
Yeah.
Pulls back your skin. So what does your skin do? It gets thinner.
Right.
Right? So what do you need? Radius to thicken and strengthen that skin.
Yeah.
You still need that. You still need Botox. You may still need some hyaluronic acid fillers. So getting a facelift isn't the answer. It's not the end all be all.
Right.
But to answer your question, if you're someone who doesn't want to go under the knife, then Radius or Sculptra is your jam.
Okay.
Oh, okay.
Because a lot of these celebrities I noticed too, it looks like they're aging backwards. They're going back to how they used to look when they were younger.
Yeah.
And not like, maybe their lips aren't as big. They just have this nice, natural, like, refresh.
Yeah. You don't see the plumpness that there was
Right, the puffiness.
years ago, the puffiness. Everyone had that like big face.
Yeah. And that's regenerative medicine.
Oh, nice.
Yeah.
Yeah, I love it. Very excited over that. Yes. We'll see you tomorrow. Right? I know. So Jess, how do you create natural results?
Well, there's a few ways I do that. Number one is I am not afraid to say no to patients. So if you come in and you got these big old cheeks and you ask me for more cheeks, I'm going to say no.
That's a good injector. Yeah.
If you come in wanting lips and your lips are like going into your nasolabial fold, I'll say, no, we need to dissolve and start over.
Yeah.
So that's one way to keep it natural. Another way is I invest a lot in training. I attend cadaver labs where I keep learning about the anatomy of the face, how the muscles work, how they work in conjunction with filler and where you place it. Our medical director, Dr. Jonathan Sykes, he's in Beverly Hills and Sacramento. He's world renowned. I just went to one of his cadaver labs a couple weeks ago in Beverly Hills. And every time I go, I learn something new.
You're always learning, Jess. Every time I see you, you're at a new event.
That's the only way.
Impressive.
Thank you. That's the only way to learn.
Yeah.
There's, aesthetics is a new industry. It's only been around for 20 years. So aesthetics has so much more to learn.
Yeah.
There's so much more. So I go to every conference I can. This year is already jam-packed. I don't know how I'm going to pass nursing school. But
you have a lot on your plate.
Yeah.
I mean, you've grown in that, like, she is doing every single, I saw you doing the Swift lift. I saw that and I was so impressed. And I'm like, holy shit, like Jess is just in trainings all the time.
Yeah.
And you're growing and getting big and people know you, which is really cool. And I think it's because she's educating herself so dang much.
Yes. No,
Definitely.
That's great.
Definitely.
That's great. It's very important. And you know what I love that you have, because I was checking out your website, but the, what do you call it? Was it the bank or how you can put?
Oh, yes.
Yeah. Yeah. So we have a beauty bank. We actually have two beauty banks. One is the basic tier. It's $150 a month. And you keep every single penny of that. We don't take any of it. It's just kind of like a piggy bank. So when you do come in, you have money saved up towards any service you want. You also get perks like $1 off per unit, 10% off skincare. If we need a model for anything, I'm calling my members first.
Oh, that's awesome.
So it's definitely something that we love having. And our patients love it too. We also have the gold tier, which is like $249 a month. So
yeah, instead of a woman coming in and being like, can you put 600 on this card and 500 on this and 1,000 on this? And then they're like taking out money, right? Because I feel like a lot of, I'm guilty.
My girls at the front know that we don't automatically send you your receipt via email because some husbands have the access to email. So would you like us to print it? Do you want it? Okay, you want to put $20 cash? You got two rolls of pennies? That's fine. We'll take it. Yeah,
it's so true. It's so true. Yeah. So I feel like everybody's like that. Not everybody, but a lot of women are.
A lot of women are, but it's fine. We'll support you, girl.
Well, I love that. No one will know now. Yes, right. Go to Jess and bank your money. That's the way to go.
That's right.
That is the way to go. Good job.
Okay, so Jess, one treatment that every midlife woman should consider?
That's a hard question. Just one?
Just one.
My brain wants to say radius, but my heart says microneedling.
Oh.
Microneedling is the most underrated treatment in aesthetics. It stimulates collagen. It helps with fine lines and wrinkles, pores, acne scarring.
Wow.
Gives you a nice glow. We include peptides with our microneedling. If you've heard of salmon sperm facials.
I've got one.
Yeah. So if there's one treatment, if you only had money for one treatment, I would say microneedling.
Okay. I have been hearing more and more about that.
Yeah.
That's, the way to go.
I've had microneedling and I don't do it often enough, but when I have done it, and I've done the salmon sperm one once and it was great.
Yeah.
And I did feel a difference. But I know that you need to be consistent. So how often do you have to get it to get the results?
Everything in aesthetics comes in threes, right?
Oh.
So you're going to want 3 treatments, 1 month apart. And then after that, just maintain with one or 2 treatments a year.
Oh, that's it.
Yeah.
And then is there downtime when you have it done?
So the beauty about PDRN, which is the salmon sperm derived DNA, is that it's regenerative. So you heal quicker. So your downtime is like 12 hours if that.
Wow, really?
Oh my God.
And it's just some redness. Yeah.
Oh my goodness.
Oh, okay. Well, that's pretty awesome.
Yeah.
That's awesome. So the microneedling, it kind of, you injure your skin by.
Yeah. So we have FDA approved microneedling pens.
Okay.
So if you're using a microneedling pen at home that's not FDA approved, I wouldn't recommend that.
Oh, really?
Yeah, absolutely not.
Oh, okay.
You can get an infection. You can cause damage. Anywho.
No.
Yeah. So microneedling is controlled trauma to the tissue to stimulate collagen.
Okay.
Right.
Awesome.
And when we go a little bit deeper, we're breaking up that scar tissue. So it helps rebuild that tissue.
Great.
Yeah.
Oh, yeah. And I've seen your machine at your office and you're always busy with microneedling. So
Always.
I know it's hard to get in, but you can get in.
Yeah. It's one of our most popular
Right.
treatments.
Right.
Yeah.
And what else do you have to offer that maybe we missed today?
We offer laser hair removal, laser facials that target redness, brown spots. We offer chemical peels for all Fitzpatrick skin types. So whether you're super light or super dark, we're able to treat you.
Great.
We offer the Aura scan, which is a 3D skin analysis.
Wow.
A
Really?
3D scan of your face and neck. We just got it in January. It's huge. Everyone loves this
The
thing.
Aura scan.
The Aura scan.
Oh, okay.
And what does it show?
It's a 3D scan of your face and your neck,
Okay.
and it'll show us, the provider, where your volume loss is, where you're just needing a little bit of help in the collagen department. It also has a skin analysis, so it shows you your browns, your reds, the things that you don't see,
Mm-hmm.
but the scan picks it up. So whatever's underneath that's going to come out later, you'll see it.
Wow. So do you use the Aura scan before like a radius treatment or?
We use it in every consult.
Oh, okay.
Yep. And if we didn't get a consult in and you just booked a treatment,
Right.
we get that consult in, we scan you. And then what we do is 4 weeks later, we'll do another scan.
Yeah.
And we'll compare the differences and we'll actually see there's less redness, there's more tightness, less brown spots. So it's not just you taking my word for it.
You're
you
right.
actually see the scan.
You can see the result.
Wow, that's
see the
really
results.
cool, Jess.
Oh, I love that.
I love that. I haven't heard of that either. Yeah.
We offer so much, I forget what we offer.
I know. We didn't even know that.
Exciting.
Yeah, we just, there's one new service that I just came out with. Actually, I just posted about it today.
Oh.
You ready for this one?
Yeah.
It's called labia fluffing.
Oh. Maybe a fluffing. I thought people were trying to get rid of the fluff.
No, we want fluff in the labia.
Oh, okay. Really? So what is that? Tell us.
How does that work?
So as we age, as we lose weight, we tend to get a little thin and crepey in that area.
Yeah.
And so we just use a little bit of dermal filler to plump it back up. The medical effects from it when you lose that volume is you get uncomfortable wearing tight clothes.
Yeah.
It doesn't look pretty. And, if you're getting laser hair removal down there, you might as well make it look pretty too.
Right?
Wow. Dude, was that like painful?
No, not at all.
Wow.
Not at all.
Andrea will give it a shot.
We use numbing agents, so don't worry.
No, but that's really interesting. And I actually think that people have talked about even doing the GLP-1s and how they felt like a little different down there for women and stuff. So is that why you started it? Because of that reason?
Absolutely.
Oh.
I mean, I'm 45 myself, so I know what we're going through.
Oh,
right?
yeah.
I've lost a lot of weight myself. So, I'm my first guinea pig.
So only women? You can't do like guys?
Actually, you can. It's called Scrotox.
Oh my God.
Oh, okay. Well, that's on another
that's
episode.
another episode.
We'll talk about that later. Oh, that's funny.
There's
That's
an injection
funny.
for everything.
Yeah. So what do you think midlife women these days are doing wrong?
Well, I don't think that they're investing in themselves enough, right? I always hear the word, I just want to age gracefully.
Yeah.
Well, aging gracefully doesn't mean that you have to let yourself go, right?
Yeah. And there is a lot of people out there that are like that, like, just age gracefully, Jen.
Yeah.
And I'm like, well, I am.
Yeah. Like, I'm totally aging gracefully. What are you talking about?
Trying.
Well, the problem is, I feel like my mind, my body is young.
Yeah.
And I want everything to match it, how I'm feeling.
Right.
So I think now people are living longer with all this, everything that's out there now. We're living longer lives, healthier lives. You kind of want everything to go along with it.
Right. If you're feeling good, you're living longer, you're living a better life, why not look good too?
Yeah.
Yes.
We're not asking to look 25, but
Right.
we don't want to look 75 when we're only 45.
But I do think that's also because of when all the fillers, the derma fillers, right, were so big. And so it did start giving everybody a different look. And so that I know that I am fully guilty of doing derma fillers for years. And I definitely kind of died down on that, slowly. And I am trying to do a lot of lasers and I'm trying to do skin stuff and things like that. But I'm never going to stop doing that. I mean, I'm trying to age gracefully.
Yeah.
But I also don't want to look like this big, plump-faced older woman. Like, I just don't want that look.
Absolutely. And like I said, the aesthetics industry is so new that when fillers first came out 10 years ago, people went crazy.
Yeah.
Right. So now we're like, hindsight's 2020. So we're looking back at it and like saying, oh, maybe we shouldn't have, put 10 syringes in her cheeks. Like, you learn as you go. And because aesthetics is so new, and now we're at that 20, 25-year mark, we're like, okay, well, it's more about regenerative. It's more about facial balancing, right? We don't want big lips when our cheeks are falling off our face, right? So we need to build that structure and balance the face.
Awesome.
Yeah,
I think
thank goodness it's going in that direction.
Yeah.
Now we're gonna go get the scans at your office.
Yeah,
the aura scan.
Yeah,
I mean, we are coming in, Jess,
definitely.
and so is everybody else because I know that you've been so crazy busy. And so, how do our listeners find you? What social media platforms are you on?
So our main social media platform is at DrippyNurseJess. Same on TikTok at DrippyNurseJess. Our website, DrippyNurseJess.com. And we're in Gilroy. If you just Google DrippyNurseJess, we'll be the first one to pop up. And your listeners get a free aura scan and a free shape scale scan.
Oh,
They just have to come in and let us know that they heard the podcast.
Oh, that's such a beautiful.
Mention Pucker Up. Mention Pucker Up.
Yes, great deal for you. Thank you, Jess.
You're welcome.
Yeah, thank you, Jess. And thank you so much for taking the time. You're
Thank you for
absolutely
having
amazing.
me. And thank you for the glass of wine.
You're welcome. Thank you.
And thank you for listening to us today. And please remember to follow us on Instagram. And you can listen to us on YouTube, Spotify, and Apple at Pucker Up Midlife.
Thank you.
Bye.
Okay, so you guys, my girl Trip Essential is by Hydrinity. It is the Prelude Facial Cleanser. I absolutely love this. It is a very, very gentle cleanser. It cleans your pores and it balances your microbiome. Go ahead and get the Hydrinity Facial Cleanser. Thanks, you guys. Bye. Thanks.